hyperthyroidism, as you can imagine, will have an impact on fertility. And women who have hyperthyroidism may have fewer or lighter menstrual periods. What's going on, everybody, and welcome to the Easy Thyroid channel. So I did a previous video entitled, "Is it possible to get pregnant with a thyroid condition?" But today's video, we are going to be looking at your chances of getting pregnant with hyperthyroidism. Now, hyperthyroidism is basically when you have an overactive thyroid, and it's the opposite of hypothyroidism. And in my previous video, I discussed the things that you need to know before trying to get pregnant. So if you haven't watched that video, make sure you check it out after this one. So let's be clear about this. Having any type of thyroid disease will have an impact on you trying to get pregnant. It's not impossible because there were thousands of women who have thyroid disease and were successful. So yes, there is hope for you. Now, hyperthyroidism occurs when the thyroid gland, which is located in the neck, generates an excessive amount of the hormone thyroxine. This can cause significant metabolic changes impacting your heart rate, body mass, and other elements of health and wellness. Now, let's look at some of the signs and symptoms of hyperthyroidism. And some of the most common signs and symptoms of hyperthyroidism will include nervousness, restlessness, excessive sweating, pronounced weight loss, fatigue, and also hair thinning or hair loss. So hyperthyroidism, as you can imagine, will have an impact on fertility. And women who have hyperthyroidism may have fewer or lighter menstrual periods. Now, when attempting to conceive, this might throw off the timing because an irregular cycle might also indicate that aspects of the typical cycle, such as ovulation, are being interrupted. Now, the TSH, which stands for thyroid stimulating hormone, is produced and released into the bloodstream by the pituitary gland. So in fact, the TSH needs to be at optimal level, and it's essential because it impacts ovulation. Now, up to 5% of women who are having difficulty conceiving have abnormal thyroid levels. Thyroid hormone levels are significant in the development of the fetus because they are necessary for growth. Now, hyperthyroidism can cause a significant drop in sperm count in males, and this is how men are impacted, which will result in the decrease in fertility. Now, when that problem is corrected, the sperm count normally recovers to normal. Those who have hyperthyroidism and are thinking about conceiving at some point or the other often wonder if their condition can be passed on to their children. So let's see what can happen during pregnancy. Well, during pregnancy, you will still need to take your anti-thyroid drugs because these treatments cross the placenta. The lowest feasible amount will be recommended to ensure that your baby is not harmed. Now, if you have hyperthyroidism, you should be aware of the many problems. If your hyperthyroidism is not under control, there's a greater chance of miscarriage in the early stages of pregnancy. And if you're taking your anti-thyroid drugs, there is a very slight increased risk of the baby having developmental abnormalities. So patients choose to have definitive treatment for Graves' disease with radioactive iodine or surgery to allow them to have a pregnancy without needing to take the anti-thyroid drugs. Also, if the dose of the anti-thyroid drugs is too high, then the baby may become underactive and may develop a goiter. Underactive in the sense of developing hypothyroidism. So when you are trying to conceive or even during pregnancy, do not stop taking your anti-thyroid drugs before speaking to your doctor, because there is a greater risk to the pregnancy from an untreated overactive thyroid than from taking anti-thyroid medication. Now, untreated hyperthyroidism can also cause difficulties during pregnancy, such as high blood pressure, poor infant development, and early birth. And during pregnancy, you'll need to have frequent thyroid function testing to make sure that you are on the right dose. I know, guys, that you want to do the right thing and you might be nervous but just be in contact with your doctor, you know. Do your own research and ask as many questions as possible. So guys, that is pretty much it for this video. Make sure that you like, subscribe, and you share this video. Until next time, bye.